Secretary of State for Health and Social Care, Steve Barclay.
Thank you, Madam Deputy Speaker. And first, may I address those remarks on behalf of Mr. Speaker. Of course, any disappointment expressed by Mr. Speaker is a matter of concern. No discourtesy was, of course, wished on the part of the government. It may be helpful just to clarify that no change of policy is being announced in this statement. It is an expansion of an existing policy, which I hope the House will regard as good news. But of course, we very much take on board any concerns that Mr. Speaker has expressed. Madam Deputy Speaker, with permission, I would like to make a statement on our national lung cancer screening programme for England. Around a quarter of patients who develop lung cancer are non-smokers. And we all remember our much-missed friend and colleague, the former member for Old Bexley and Sidcup, James Brockenshaw. He campaigned tirelessly to promote lung cancer screening and was the first MP to raise a debate on this in Parliament. His wife, Cathy, is continuing the brilliant work that James started in partnership with the Roy Castle Lung Cancer Foundation. In 2018, after returning to work following his initial diagnosis and treatment, James told this House that the government should commit to a national screening programme and use the pilot to support its implementation. He said, and I quote, and I'm sure many colleagues in the Chamber will recall, "If we want to see a step change in survival rates, to see people living through rather than dying from lung cancer, now is the time to be bold." Now, despite being a non-smoker, James knew that the biggest cause of cancer was smoking, and the most deprived communities had the highest number of smokers. And that's why I'm delighted that today the Prime Minister and I have announced targeted national lung cancer screening programmes at a national level, building on our pilot, which will be targeted at those who have smoked in the past. Lung cancer takes almost 35,000 lives across the UK every year, more than any other cancer. Often patients do not have any discernible symptoms of lung cancer until it is well advanced. In fact, 40% of cases present at A&E. Since its launch in 2019, and even with the pandemic making screening more difficult, our pilot programme has already given 2,000 lung cancer patients in deprived English areas an earlier diagnosis. And that matters because when cancer is caught at an early stage, NHS England state patients are nearly 20 times more likely to get at least 5 years to spend with their families. We all know smoking is the leading cause of lung cancer. It's responsible for almost 3/4 of cases, and in deprived areas, people are 4 times more likely to have smoked. So we've deployed mobile lung trucks equipped with scanners to busy car parks in 43 deprived areas across England. Before the pandemic, patients from these areas had poor early diagnosis rates, with only a third of cases caught at stage 1 or 2. To put that in context, while a majority of patients diagnosed at stage 1 or 2 get to spend at least 5 more years with their children and grandchildren, less than 1 in 20 of those diagnosed at stage 4 are as fortunate. But thanks to our targeted programme, 3/4 of lung cancer cases in these communities are now caught at stage 1 and 2. Targeted lung cancer checks work. They provide a lifeline for thousands of families, and we need to build on this progress. And that's why we are expanding this programme, so anyone in England between the ages of 55 and 74 who is at high risk of developing lung cancer will be eligible for free screening, following the UK National Screening Committee's recommendations that this will save lives. This will be the UK's first, and indeed Europe's second, national lung cancer screening programme. And if results match our existing screening, and there's no reason to think they won't, when it's fully implemented, this programme will catch 8,000 to 9,000 people's lung cancer at an early stage each year. Each and every year, this means there will be around 16 people in every English constituency alive 5 years after their diagnosis who wouldn't have been without the steps we are taking today. That means many more Christmases or religious festivals with the whole family sat around the table. Alongside screening to detect conditions earlier, we are also investing in technology to speed up diagnosis. We're investing £123 million in AI tools such as very chest, which allows radiologists to review lung cancer X-rays 40% faster. So suspicious X-rays are followed up sooner and patients begin treatment more quickly. So how will our lung cancer screening programme work? Well, it will use GP records to identify current or ex-smokers between the ages of 55 and 74 with high risk of developing lung cancer assessed through telephone interviews. Anyone deemed at high risk will be referred for a scan and they will be invited for further scans every 2 years until they are 75. Even if they are not deemed at high risk of lung cancer, every smoker who is assessed will be directed towards support for quitting. Because despite smoking in England being at its lowest rate on record, tobacco remains the single largest cause of preventable death. And by 2030, we want fewer than 5% of the population to smoke. That's why in April we announced a robust set of measures to help people ditch smoking for good, with 1 million smokers being encouraged to swap cigarettes for vapes in a world-first national scheme, with all pregnant women being offered financial incentives to stop smoking, and HMRC cracking down on criminals who profit from selling counterfeit cigarettes on the black market. This lung cancer screening programme has been a game changer for many patients, delivering earlier diagnosis, tackling health inequalities and saving lives. We're taking a similar approach to tackle obesity, the second biggest cause of cancer across the UK. The pilot we announced earlier this month will ensure patients in England are at the front of the queue for innovative treatments by delivering them away from hospital in community settings. Together, this shows our direction of travel on prevention, which is focused on early detection of conditions through screening and better use of technology to speed up diagnosis and then treatment. Because identifying and treating conditions early is best for patient outcomes and for ensuring a more sustainable NHS for the future for the next 75 years. I commend this statement to the House.